Welcome back to Alive and Well Community's Daily Dose, your daily dose of support. While most of our episodes have really focused on our own personal self care, today we're going to transition to really talking about community care. Now, this becomes really important because, in light of current events, we know that our national attention is focused on the coronavirus. But what that also means is that other forms of trauma too often persist in silence. And so today, in supporting an alive and well community, we're going to focus on the very important topic of violence, of focusing on whether it be domestic violence or child abuse. And we have a very great panel put together to help raise awareness and bring attention to this important issue of how together we can continue to have an alive and well community during this time. So, joining me, we've got lots of wonderful folks. We have Kara Wilcox, and Kara is with Children's Division Central Office, and she serves in the role of Prevention and Safety Unit Manager. We also have Jennifer Carter Dockler, and she is the Public Policy Director for the Missouri Coalition Against Domestic and Sexual Violence. And we also have a great friend of Alive and Well Communities joining us, and that's Dr. Patsy Carter with the Center for Excellence in Child Wellbeing, who has also prioritized over a decade to bringing trauma-informed care to the state of Missouri. So to all of our guests today, thank you so very much for joining us as we really shine the light on an important issue that too often persists in silence. And so, Jennifer, I really want to ask my first question to you. And my first question is, why is it so important for us to raise awareness of the issue of intimate partner violence, whether it be physical violence towards an intimate partner, sexual, verbal, spiritual, financial, technological, during this time?
Thanks for the question. Anytime it's important to raise awareness about intimate partner violence because it's happening more frequently in our communities than most individuals realize. But what we're experiencing right now is really a unique time. Although we can draw from what we've seen in other kind of natural disaster times, the unique nature of the pandemic and how we're having to respond is still really new. And so I think it's very important for people to recognize during this time that intimate partner violence is still occurring. That it's not necessarily that the pandemic is causing intimate partner violence, but that when there were different forms of abuse occurring in a relationship, that it gets exacerbated, especially with the dynamics we're experiencing of stay-at-home orders, extreme, social isolation, a lot of uncertainty or confusion about what resources are available or not available. With the stay-at-home orders, can somebody still go access shelter if they're in intimate partner violence? So it's really important during this time that we recognize that help is still available, and how are we responding when intimate partner violence is occurring in our communities.
Wonderful. And that's so important that we raise this awareness. And a question I have for you, Jennifer, is during these times when, stress in our community is at an all-time high, do we also see severity of the intimate partner violence increase as well?
Absolutely, it can. As I mentioned, that we usually see in these sort of natural disaster times that when abuse was occurring in a relationship, that based on the stress of what is happening, it exacerbates. So maybe emotional abuse goes into physical assaults, or the severity of the physical assaults might increase. So we absolutely see exacerbation about what has been occurring in that relationship. One of the things we just had phone calls or Zoom calls with domestic violence agencies across the state within the last couple of weeks, just to kind of touch base with our member agencies to see what is happening. And right now, of course, this can change any day, we're seeing a very split response. Either they're saying it's very unusual that hotline calls have really slowed down and they're just waiting because at some point they know they're going to increase again, or we're seeing kind of a lot of calls coming in primarily from people who had already been receiving services, again, asking questions about what services are still available. Can I still call y'all for assistance? What do I do about my ex parte order of protection? So we know the agencies that are currently seeing a lull, we don't anticipate that to last. But again, this is just reinforced by the confusion of what do the stay-at-home orders mean, or what does social distancing mean? And with so many businesses and agencies shutting down, there's confusion about what is still open and available to help.
No, and that's important information to have. And we'll talk about resources available during this time a little bit later. So thank you for highlighting that. Now, Kara, we know that as domestic violence increases, we can also see an increase of violence and abuse towards children. Can you share a little bit more about that with us?
Sure. So we know that many of our families who experience domestic violence also experience child abuse. I think the estimate is somewhere between 30 and 60% of children who've been abused have also experienced domestic violence, either witnessing it or just knowing that that's going on in their family. So if we're seeing an increase in domestic violence, we can surely anticipate that there's going to be an increase in child abuse as well. We too are concerned that we are going to be seeing an increase in the severity of abuse with our kiddos. We're have a less hotlines coming in, but we're starting to hear that those are a little bit more severe than we normally have to deal with, and we've seen that across the country. So we are very concerned about that right now.
Yeah, and Dr. Carter, one of the things we hear is that, well, if only the guardian or another parental figure is experiencing the violence, then the kids must be all right. Is there any sort of impact on well-being for our children, even if they're not the ones experiencing that abuse, but it's happening in the home to a parental figure?
Yes, Sean, thanks. That's an important point to consider, and some folks don't think that is true, but we actually know that children who are experiencing or living in a home where there is domestic violence, and whether they're seeing that through sounds in the home, the sights in the home, or actually just seeing the results of the abuse, a broken lamp, a bruise on a caregiver, that this impacts children. It increases their anxiety, and part of that we know is related to the impact that toxic stress can have on brain development. So it can increase anxiety in children. In young children, you might see that their behavior will regress. They might start sucking their thumbs or wetting the bed, or again, school-age children, you can often see it in their self-esteem. They may have more somatic complaints. They may feel guilt, like that this is partly their fault, feeling like maybe they're causing the stress. And in teens, we often see that they'll start acting out, particularly males, that they may become aggressive themselves. And that's just kind of in the short term. And in the long term, we also know that children who grow up in homes where there's domestic violence, actually for males, typically they have an increased risk of becoming a perpetrator of abuse themselves. And for females, they end up having a much higher rate of being in relationships that are abusive or being sexually assaulted themselves. So we see that there are both short-term and long-term impacts of domestic violence on children, even if they are not the recipient of the violence themselves.
So even if we don't see some sort of impact on a child today, it doesn't mean that there aren't lasting consequences or impacts for children who witness even any form of domestic abuse.
Right. Again, you can see the long-term effect, and we do know that it can impact the brain with the release of higher levels of cortisol, which for those who are, working in the field of trauma know that cortisol is often released in the body, and that can have a long-term impact on our physical health, as well as impacting our emotional and social health as well. So we'll see impact on parts of the brain, such as the hippocampus, which it really is kind of our emotional center, and can control our memories. So we see, again, both that short and long-term effect. And particularly for the young children, when their brain is developing in that type of situation, that can certainly lead to long-term effect into their adulthood.
No, I think that's really crucial for us to understand the lasting impacts of abuse. So now that we know this is a concern that we have to be aware of, that we can't allow to persist in silence, especially during this time when our focus is so hyper tuned to what's happening nationally and locally. Let's talk now about what resources are available, because I think, as Jennifer mentioned earlier, sometimes this stay-at-home order can feel like we're even more isolated. It can increase our sense of hopelessness. And so, Jennifer, can you start by talking about what resources are available if someone is experiencing intimate partner violence?
Sure. Services are still being provided across the state. There's an online directory off of MCA DSV's website that lists the service providers, what counties they primarily serve, and the range of services that they typically offer. That said, this is not a typical time, so we're encouraging individuals who are in those service areas to directly contact the domestic violence agency to find out what services they're still providing. They're absolutely still providing hotline services where individuals can call 24 hours a day, 7 days a week to talk to a trained advocate, to safety plan with them, to explore their options. They can still provide advocacy services via the phone, or explain how their local court is handling orders of protection right now with the Supreme Court order to reduce the in-person cases. Some counseling is being provided depending on the technology capability of that agency, and shelter is still a viable option for individuals, both mothers or fathers and their children. So as many services that the agency is able to continue providing while following the CDC guidelines, they are doing so during this time. An individual can also always call the National Domestic Violence Hotline number, and they will three-way connect with a local service provider in Missouri. And what we want folks to know is that there are resources still available during this time, whether it's shelter or just talking to someone on the phone about their options. Another benefit to the National Domestic Violence Hotline, if somebody based on quarantine or stay-at-home orders is not comfortable making a voice phone call, they could instant chat over the website. There's also several agencies in Missouri that are doing a text crisis line, and so that information is also available off of the MCA DSV website. So texting or online chatting could also be an option based on, again, the dynamics that we're having to experience right now and be mindful of.
Wonderful. It's good to know that there are resources available and that we don't have to be alone, that there's still options for help and support during this time. And I'm sorry, Jennifer.
That's okay. I was going to say agencies can also talk to individuals about their concerns, following up with some of what Dr. Carter talked about. Some agencies have typically provided children's services or support. I think with some of the dynamics of the pandemic, a lot of protective factors that generally have helped with resiliency among kids right now, that's a little bit more limited, like participating in school sports or other activities or seeing other extended family. So advocacy agencies can also help answer questions that victims might have and strategize around how services could still be provided.
Wonderful. It's good to hear that there are options available. And Kara, can you share with us a little bit about the resources available if child abuse is suspected?
Sure. The Children's Division is really trying to operate as normally as possible. We're still making contact with families, Some of that is virtually. We are in our contracted service providers are also continuing to provide services. So it'd be, like home visiting services, parent aid services, mental health services that we use, different things. They're still out there providing support for our families. So some of that contact is done virtually at this point, but our hotline, our child abuse hotline, is still open 24/7. So and our investigative staff that then go out and respond to those reports are still working and available around the clock. We've seen about probably a little over a 50% reduction in our hotline call volume. So we have a lot of concerns that there are kiddos out there that are not being seen by anybody outside their family and that are very vulnerable. So, but we are continuing to operate and seeing those children in response to a hotline. We are doing everything we can to see them face to face because, our primary concern right now is making sure kids are safe. I also want to make a plug for our sister agency, the Family Support Division. They have expanded their service hours, I believe at this point, to 7 days a week, and have really kind of increased some of their eligibility requirements for things like food stamps and Health Net. So I also want to make that plug that they are really trying to do what they can to help support Missourians.
So I think that's a wonderful segue. How is it that our viewers, whether they're tuning in live or whether they're watching this broadcast after the fact, how is it that we can all play a role to kind of disrupt this cycle of abuse that's happening, whether it's intimate partner violence or child abuse? How can we help to prevent this from happening in the first place to ensure we're building an alive and well community?
So bystander intervention is a
Go ahead, Jennifer.
I was going to say bystander intervention is a great intervention. It's right now, it's what we're doing regardless of if intimate partner violence is occurring, but it's even more important if it is, reaching out to friends, family, loved ones, and just touching base to say, hey, how are things going? Is everything okay? Do you need to talk? Just reaching out to folks to be able to say, I care, how are you doing with everything that is happening?
Yes, and if I could add to what Jennifer was saying, I think it's really important in what Kara said about, kids aren't in schools right now. So we don't have some of the eyes on children that we may have, and knowing that schools are one of the most frequent reporters of abuse, that we need to be alert to what's going on in our community, in our neighborhood, and with our friends and families. So I think it is important that people do check-ins, particularly when they know that there are family or friends who are vulnerable. I think additionally, we can do things like our home settings as much as possible to allow children to know what to expect. Things such as even getting outside to do some exercise. Luckily, the weather is getting nicer. We can't necessarily play basketball and be in that close a quarter with our neighbors and our friends, but that doesn't mean that we can't be outside getting active and helping burn off some of that tension that we're feeling. The things like limiting contact or limiting exposure to the news and what's going on. We all need to stay abreast of information, but we don't need to be overwhelmed by it. So I think things like, video chatting, FaceTime, making sure kids and adults are getting enough sleep, they're eating well, getting that exercise and getting outside, all can help us not only in this very unique and difficult time, but all the time in being able to meet those health needs for both our social and physical well-being.
So I think it's really important for us to understand that we can actively help to disrupt the cycle. And so understanding the role of bystander intervention is really important during this time. And as Dr. Carter and Kara both mentioned that, currently children aren't coming into contact with routine mandated reporters, but that doesn't mean that everyone in the community can't play a role. And as Dr. Carter mentioned, that there are more benefits to, social connectedness during this time of social isolation than just kind of the wellness benefits, but helping to also very much so ensure that our children are being taken care of, that abuse in the home isn't happening to any one of the family members. Now, I just want to ask you all that we know resources are available. For someone who may be teetering of, is it safe to report during this time, or I'm concerned that people may come into more contact with the virus as we're trying to take care of ourselves, what advice would you give folks who are considering reaching out for support, whether it be to Family Support Division or whether it be reaching out for resources in the community?
Well, from the domestic violence resources, I mean, one of the first services that was ever provided was Hotline, so that somebody could call. And in the context of our work, Hotline is not, making a report of something that leads to an investigation. It's calling a service provider who is available 24 hours a day, 7 days a week, just to be able to talk through your options and to get validated and to support. I feel very fortunate in this time that the domestic violence community has had a long history of providing really effective phone advocacy and support. And so that has been a long history of our movement, and that service continues. So if anybody has any questions, you can call the hotline and they can answer any questions that you may have and validate your experience.
Yeah, and I will add too, for the Children's Division, we've added for the time being a new referral criteria through our protocols at the hotline, so that if something doesn't necessarily rise to the level of abuse or neglect, but you're still concerned that maybe there's a lack of resources, or historically you've known that there's been involvement with the Children's Division and you're just concerned about kids, that you can call and we could classify it in that, and we can then have our staff just really kind of maybe make a phone call, or depending on what the situation is, actually go to the home and check in on those kids. But it's not like a full-blown child abuse and neglect report, but we're still able to just see what we can do to help families.
Is that more along the lines of a wellness check, that if we just want to ensure the wellness of a child or family?
Sort of. I mean, it does need to be tied to a concern, maybe a lack of resources, lack of food, just that you're concerned because that somebody's unemployed and there's maybe a history of substance abuse and there's been concerns about those kids in the past. Whatever that might look like, we can do a little bit with that.
Now, I also want to ask, can you all talk to us a little bit about this notion of safety planning, of maybe we have some concerns in the home, but what can we do to just kind of proactively prepare for safety if we have any concerns?
So for domestic violence, there are some different safety planning tools and strategies off of MCA DSV's website, as well as other information about what is the typical order of protection process. Knowing, again, right now things are not typical. A local service provider, staff at the Domestic Violence Agency could also expand beyond those kind of formatted safety plan tools that are available off of publications on our website. But another thing to keep in mind that can help with someone's sense of safety or well-being is, for domestic violence service providers in the state, they have confidentiality. And so when somebody calls them, that is a private confidential call unless the staff person is a mandated reporter.
Other thoughts around safety planning from Dr. Carter or Kara?
I mean, at the Children's Division, we always have done kind of those immediate safety planning and interventions. We know when a child is unsafe and we need to figure out how to reduce that safety threat. We also, as we are actually doing ongoing case management with families, we are working on developing long-term safety plans. So if there's a problem that comes up, even after we're not, after we're out of the family's lives, that they have a safety network built around them that can help step in when needed, just to eliminate any kind of concerns before they arise to actual child abuse or neglect. So we have both that immediate and that long-term safety planning that we should be doing.
Yeah, and I think that's really important, Kara, to think about how we build a long-term safety support network for the families. And I think, again, with children, it's important to, if there's a history of domestic violence in the home or child abuse in the home, to be talking to the children about their fears, letting them express how they feel, and talking with them about a safety plan that they may wish to go into a bedroom or to go outside if the adults are getting heated and there's concerns that there may be violence in the home, knowing who that they can call. I think all of those are very important in preparing a child, but doing it without creating a whole lot of anxiety. It's about being prepared and empowering that youth so that we can tell them about boundaries, and we can tell them about, what is healthy relationships as opposed to what they're experiencing. So I think all of that is important in thinking about the safety of the children in the home, both short-term and long-term.
Now, Kara, we do have a question that came in, and the question is, what is it like to call and make a hotline if we suspect child abuse? Can you talk us through that process of what we can expect and what that experience may be like?
Sure. We have two different ways that you can report. You can report through our actual hotline number and speak to an intake worker. You can also go online and make that report yourself just online. So it's really kind of what is maybe more comfortable for you. But they're going to ask you lots of questions about what demographic information, obviously, and then what your concerns are. And they may try to also ask you questions about what kinds of things does the family have in place that shows that they can keep kids safe at times. Those existing safety factors. They'll ask you too, kind of a scaling question from 0 to 10, how unsafe you feel the situation is. And I think sometimes people feel like they have to give those answers and get discouraged if they don't have those answers. But, you don't have to have all the answers to the questions that are asked. It's just trying to pull out all sorts of information that you may have that you don't realize you have, to put together a whole picture of that family.
Wonderful. Wonderful. So to our panel, we're coming close to our time together, and I just want to ask, are there any other final words you'd like to share, or any other sorts of insights you would like to share with our viewers who may be tuning in at any point?
Well, thank you for covering this topic, and just to remember, at a time where we can all feel very alone, we are not alone, and that help is available.
And to follow up on Jennifer's statement, when you were talking about resources before, Sean, I know Missouri HealthNet, MoHealthNet, which is the Medicaid agency for our state, and a lot of health providers are expanding telehealth and having virtual counseling sessions available. So there is help available. There's the crisis lines. The Department of Mental Health has a crisis lines for those who may be feeling overwhelmed and stressed. And for those who are feeling overwhelmed and stressed and knowing that can increase the risk of violence in the home, please reach out. There are people there to help you and understand your situation and can assist you without judgment.
Wonderful. Wonderful. Well, I want to say thank you so much to our panel today for joining us and really raising awareness around an important issue, and recognizing that there are resources available to support individuals, as well as the fact that we, working together, providing one another support, can help to disrupt this cycle of abuse happening for all individuals in our community. So thank you so much to our panel today for joining us. So One last thought that I would like to share with viewers is that while today we covered intimate partner violence and child abuse, we also want to recognize during this time that other forms of abuse are also at heightened levels, and making sure that those don't persist in silence either. For our elders in the community, they may be more vulnerable to experiencing abuse, as well as those living with any type of disability. And we will make sure that numbers to report that will also be available belowhand after our broadcast. So remember, together we can all build an alive and well community. And so for those of you who are joining us for our daily challenge, it's going to be to socially connect today while staying socially distant, of course, remembering that it's not just about providing that connection and helping to support someone and not feeling so alone, but that also you reaching out and connecting could help be preventing abuse from occurring. So make sure that today you reach out, and as we continue this social distancing, so we stop this epidemic from persisting in silence. So again, thank you to our panel, and for those of you joining us, please join us tomorrow as we talk more about the resources that are available in our community to ensure that all of our needs are being met. We'll see you back here tomorrow.
Thanks.
Thank you.
Bye-bye.
Bye.